Well, good afternoon, everyone, and thanks for being here with us today. It is my extreme pleasure to welcome each of you here today with my thanks for being part of this very special celebration. I'd like to personally welcome the Lenormand family, as well as our Dean of the College of Medicine, Dr. John Zubialdi, and the CEO of OU Health, Chuck Spicer. Additionally, I'd like to recognize and thank our architectural and design group from Miles Associates, as well as our wonderful construction team from J.E. Dunn. Thank all of you for being with us today. Today, we officially open the doors of the Quincy Lenormand Nutrition Center. This transformational gift has set the stage for our health system and how we are able to use our new Office of Philanthropy to engage other leaders in our community to support our newly established not-for-profit health system. For that alone, we are grateful. For your particular gift, however, it is significant to the mission of Oklahoma Children's Hospital at OU Health because of the ways it will enhance the services we provide. But there's a history and there's a personal story here that we want to make sure we celebrate today. In a moment, you'll hear from David and Corey Lenormand, parents of Quincy Lenormand, for whom the center is named. They'll tell you what it was like experiencing pregnancy that was, for all practical purposes, normal and routine, and how in the 24th week of pregnancy, everything can change with very little warning. Becoming intimately acquainted with staff and operations of the neonatal intensive care unit isn't what moms, dads, and families hope for when they welcome their new babies. But Quincy's family will tell you that Oklahoma Children's Hospital was absolutely the best place they could have been, especially given the circumstances that they faced. Their family became part of our family. For nearly 3 months they were with us, and they never forgot the skill, the expertise, the dedication that they witnessed, and the compassionate care that they felt. These elements are the labor of love that they gave their daughter the best chance at life. Time passed, Quincy grew up, and Dave and Corey couldn't stop thinking about the experience, pondering ways that their family could help support the work of Oklahoma Children's Hospital to help other babies and other families. As the Lenormands considered an appropriate gift, NICU personnel and hospital leaders were focused on enhancing resources and capabilities to better meet the diverse nutritional needs and demands of our youngest patients. Laying the groundwork that began to move this project forward, a team from Oklahoma Children's Hospital visited several other facilities in the Dallas-Fort Worth area, analyzed best practices, looked at other nutritional handling needs, observed thoughtfully planned facilities, and worked tirelessly to identify the most appropriate model for us to emulate at Oklahoma Children's Hospital. The pieces came together a little more than a year ago when David and Corey made a substantial monetary gift that would establish the Advanced Nutrition Center that we celebrate here today. The Quincy Lenormand Nutrition Center is part of our calling to care. As I look back on the journey that brought us to this day, I'm overwhelmed with gratitude. We don't just celebrate the center, a space in the hospital. We celebrate what it means for the future of those critically ill newborns and other children with complex needs. We celebrate because we know the lives that will be saved and the families that will be touched from this gift. And now I'd like to introduce Dr. Trent Tipple, our Chief of Neonatology and Medical Leader at the NICU at the Oklahoma Children's Hospital. Trent?
Thank you, John, and thank you for the opportunity to represent the neonatal providers. One of the first couples that my wife and I met upon relocating to Oklahoma City in 2019 were actually Dave and Corey Lenormand. And hearing their story and knowing the role we get to play as providers and leaders in the state of Oklahoma is it's an incredible honor. When our families face adversity, we find reassurance in the knowledge that children are strong, they're resilient, but that strength and resilience coexist with great vulnerability. That really describes the babies just down the hall in our neonatal intensive care. Life is fragile, especially that life of an infant born prematurely or an infant born with a critical diagnosis. But thanks to phenomenal advances in neonatal perinatal medicine, we're far less likely to be blindsided by unexpected diagnoses and complications, and we're far more likely to have positive outcomes and positive stories like the one you hear today. At Oklahoma Children's Hospital, we have a well-earned reputation for our readiness to act with critical care measures that sustain and save life. Imagine Quincy Lenormand at only 2 pounds. All of the systems in her tiny body, including her digestive system, are underdeveloped and not ready for prime time. As my mentor told me in training, and as I tell the trainees that I experience now, nutrition is the key driver of outcomes in premature and critically ill babies. Scientifically, we strive to precisely approximate the rate of growth and weight gain an infant should experience were they still inside the womb. Our success is critical if we are to achieve the best developmental outcomes. Our success has long-term benefits in the prevention of chronic diseases that would otherwise develop in the lives of our patients. The reality is that the Quincy Lenormand Nutrition Center enables us to take a huge leap forward in providing the best nutrition for each and every baby that comes into our care, and this impact is transformative. The expanded space facilitates the work of the staff who can now perform their work with the greatest degree of precision and efficiency. The center uses information technology specifically developed to provide optimal neonatal nutritional care for every baby we serve. The Timeless system uses a unique barcode identification algorithm to ensure that only a correct match for every feeding comes to each and every baby, and that feeding unit has not expired. This system is able to track and trace the preparation of that feed and inventory it within the hospital. The system also tracks and traces mom's milk, the best medicine we have to give our babies, from receipt to the baby, interfacing directly with that patient's electronic medical record. Importantly, and most excitedly for me, the Mirror's Human Milk Analyzer, and we're one of the few institutions in the country to have this technology. It determines how and to what extent a baby's milk must be fortified, customized to meet his or her specific nutritional needs. This truly represents personalized medicine at its finest in our field. Excitedly for me as section chief, we're able now to support the career development and training of nutritionists, scientists, nurses, and physicians on our comprehensive academic medical center campus. Indeed, we're currently working on our first National Institutes of Health grant funding application as a collaboration between the College of Nursing and the College of Nutrition. New knowledge gained from studies such as these will enable Oklahoma Children's Hospital and our Health Sciences Center to be at the forefront of our field in neonatal nutrition. Through the linkage of milk composition to the growth and outcomes of the babies we serve, and through the development of best nutritional practices that we can share not only locally, but regionally, nationally, and internationally. Extensive analytics and projections, I believe, will be completely inefficient or insufficient to estimate the far-reaching impact of the Quincy Lenormand Nutrition Center, clinically, educationally, and scientifically. Mr. and Mrs. Lenormand, thank you for your vision and your passion for the babies of our state. We pledge to honor the commitment that you have made by making that commitment back to you. I can confidently say that because of this commitment, we can ensure a better chance at life and improved outcomes for babies in Oklahoma and beyond. And now I'm delighted to welcome Jamie Kilpatrick, who is our NICU director and a longtime acquaintance and former nurse of Quincy Lenormand.
Thank you, Dr. Tipple. Years ago, people who chose careers in healthcare were cautioned, don't become emotionally involved with your patients. While professional boundaries are appropriate, I ask you, what is healthcare without caring, and what is caring without emotion? I became involved with Quincy Lenormand and her mother, Corey, when a routine, if you will, pregnancy took an unexpected turn for myself and our team. That struggle became our struggle. It's rather strange and wonderful to be here today to see a life's journey come full circle. This rare event, of course, brings me great pride. Pride in the kind of skilled expertise, teamwork, care, and resources that help sustain life every day. Then, as now, Oklahoma Children's Hospital delivered gold standard neonatal critical care. Pride in Quincy, who is who is such a joyful reminder of how our work matters every day. That she is present with us to celebrate this occasion makes an eloquent statement about the tenacity of life. Pride in our partnership with the Lenormand family, forged in crisis and strengthened through the years. While not healthcare professionals, they share the same passion to help others in ways that see them through some of the most difficult times that perhaps they'll ever face. The Quincy Lenormand Nutrition Center elevates and expands and centralizes multiple means of nutritional support. The resources it makes available ensures that patients of Oklahoma Children's Hospital and the NICU and beyond have the benefits of science-based nutrition practice and emerging technologies. Quite simply, the Nutrition Center will save lives and become a part of other stories not unlike Quincy's. Thank you, David and Corey, for your commitment, passion, and generosity that have made our shared dream a reality in the Quincy Lenormand Nutrition Center. Thank you.
I'm Corey Lenormand, and I am Quincy's mom. I gave birth to her at 24 weeks. Picture perfect pregnancy. Felt great the whole time up until the day before I delivered. And when she was delivered, they gave us a 10% chance of survival. Would never be normal, never walk, talk. And I just could not imagine that. I was like, there's just no way. There's got to be something we can do. And she was here for 3 months, and all the doctors and neonatologists and the nurses were just honestly angels on earth. It was really traumatic for a new mom. It was my first baby, to leave her after being with her for 1 day. And the only way really to get through all of that was, knowing that these nurses and these doctors here at the hospital had her, and took wonderful care of her. Brought her home, and she was 4 pounds, and as you can see today, she's, just a beautiful young lady, 18 years old, a senior in high school, and I'm going to get all sappy, but this is just, such a blessing, and it's really a dream come true, because we have for so many years wanted to do something to give back and to thank everyone here for giving us this wonderful child, and now she's almost an adult. She's 18. But anyway, just wanted to thank you so much, and we are so honored and proud to have this nutrition center named after Quincy.
Yeah, I'm proud of both of them, that's for sure. You hear a lot of numbers when there's traumatic things happen. There's lots of numbers that are thrown out. And the one that resonates with me that Corey reminds me of often is 100% chance that something's significantly wrong with Quincy. 100% chance. And other than a pretty high level of moxie and occasional sass, I haven't found anything wrong with her yet. But as you can see, she's an outstanding student. She's an outstanding person. And the heroes here, Jamie, staff, with the technology of the time, it was just an unbelievable miracle that for us as a family. And the love of this particular family, support, constant vigil by aunts and grandparents, and Nurse Jamie and staff. I hear stories about Nurse Jamie being a big runner and being a workout girl, and I think she was doing push-ups and set-ups next to Quincy when she wasn't supposed to be there. And so that was what we wanted to do, was something that stacked the odds even further. And Jamie did, and the staff did a wonderful job of explaining to us that about what was required from a fortification standpoint of nutrition, and what the situation really was here and what it could be. And I was mostly impressed with being able to link up digitally with other NICUs and learn the tricks that they perform, and how many children were going to change their trajectory here is why Jamie knew when this came up that this was for us. And we're very proud to be a part of it. So thank you all so much for everything that happened, all the construction people and the doctors. Thank you so much. And we're very proud of our Quincy, and very proud of you guys too. So thank you.
Okay, I just wanted to say thank you for everyone coming. It means so much to me and my family, and thank you for just being part of my story. I'm so excited that this nutrition center is getting to open, and we've been waiting for so long, and I'm just glad to give back to the place where I started. So thank you guys for coming, and yeah.
Thanks, Dave. Corey, Quincy, you guys ready to cut the ribbon?
Okay, come on, girl.
We've done it. We're gonna get Dr. Tibble up here, and if somebody can grab the very large scissors.
Wait till we get going.
Careful. Very big scissors.
Oh, yeah, she's a lefty. That's get on this side of the ribbon.
Yeah, come on this side.
I follow instructions.
Anytime.
Yep.
Been that concerning since kindergarten.
All right, thanks again for being here today, everybody. We certainly appreciate it. We're glad to have extended family with us as well. And so I think, are we going to do some quick